Based on a true story, imagine your friend, an athlete, gets a simple urinary tract infection, a UTI, and she goes to an urgent care clinic and the infection is mild. The bacteria can be killed by almost any antibiotic, but the provider there chooses a very strong drug, in this case called Cipro, ciprofloxacin. Levaquin and Avalox is another one. It may sound fine to you, but the strictest warnings from the government agency that regulates medicine, the FDA, says this was a dangerous mistake. The problem with Cipro and the other fluoroquinolones is significant, and the FDA has put this most serious warning in a black box. Warning on Cipro and all similar drugs, because Cipro can cause serious long-term side effects that are sometimes not reversible. And the FDA warns that for simple infections, like a minor UTI that she had, the huge risks of Cipro and Avalox and Levaquin are greater than the small benefits. They say they should be only used if there is no other treatment option. The three biggest risks are, especially for an athlete, tendon rupture. Cipro weakens the tissues like the Achilles tendon, that big tendon in the back of your ankle, and this makes it more likely to tear or rupture. And for an athlete or anyone who runs, that's an injury that may take months to heal or even require surgery. Number two, permanent nerve damage or neuropathy. Those fluoroquinolones can damage the nerves in the arms and legs, and this can cause severe symptoms like burning, tingling, or pain that may last forever, well after the infection is gone. And three, those fluoroquinolones like Cipro have also been linked to enlargement and potential risk of tearing of the aorta. Again, it's rare, but that's life-threatening. So in my friend's case, since the infection was sensitive to every antibiotic, the provider should have chosen a safer drug first. And there are so many antibiotics that could have been used. You know, UTIs don't carry the risk of permanent damage of tendons and nerves, right? So use other antibiotics like nitrofurantoin or Bactrim or penicillins or cephalosporin. When a doctor chooses Cipro instead of these earlier and safer options, they are prioritizing the powerful, risky drug over a simple, safe one. They are making an unforced error, creating a risk that didn't need to exist. I hope that helps.